Ditto, how are you? Kamusta? Good
Good. How are
afternoon.
you, Anton?
Good
Good
afternoon.
afternoon. Good
Yes.
afternoon, everyone.
Good afternoon, everyone. We're back, and
Yes, we're
uh,
back.
and this is a special episode on diabetes, how to prevent and fight diabetes with Dr. Joel Lopez, MD. So maybe can you introduce again Dr. Joel
Yeah,
to
so
our
Anton, like you said, we're back with Dr. Lopez. For those who have been watching our show with Dr. Lo, he's he's been a constant source of our knowledge here on the on Tuesdays with Dr. Joel Lopez. He's slowly being known as Dr. Wellness, and he is the one that the director of J Lopez MD Medical Group in Makati, and we're lucky today to have him because one of five Filipinos actually are diabetic or pre-diabetic, and
gan-
that pare translates to about 7.2 of the population, which is
wow.
equivalent to about 6.3 million Filipinos reported to be diagnosed with this global epidemic. So,
Yeah.
and of course, diabetes as of this, it ranks sixth cause of death of Filipinos. So we're lucky to have Dr. Lopez. So welcome
Yeah.
everyone to
Welcome
our
everyone.
Tuesdays with Dr. JLo.
Hello. All right. Thank you. We'll bring Dr. Joel in. Hello. Hello.
Hi,
Good
good
afternoon.
afternoon, guys. How are you doing?
Good. Good. We missed you, Doc. Missed you,
Yeah,
Yeah.
we
Doc.
were out for a couple of weeks.
Yes.
How
So,
many weeks have we been on break? That's been like 2 weeks, I think.
Right.
2 weeks. So we're starting a new series of disease-focused live streams, no? And we're starting with diabetes. Good afternoon. Welcome to those people watching in the live stream today or watching during the replay. You can ask your questions or comments in the comments below, even after this live stream. So we'll get Dr. Joel to answer them. Now, this is a special episode. We have a special gift at the end of the show. So make sure to watch throughout Dr. Joel's presentation and get to know how to get the Fora blood glucose meter at the end of the show. All right. And all right, we'll turn it over to Doc J. Or maybe you want to say something, Dito?
No, we're good. Well, Fora, thank you very much for we're partnering up with Fora and TSMC Philippines to give away glucometers. So, at the end of the show, we'll be telling you how to join the show, and then the succeeding shows with Dr. Joel Lopez will give it away.
All right. So without
Yeah.
much further ado, going to Dr. Joel Lopez on diabetes.
Hi, good afternoon, everyone. So, our topic for this afternoon is about diabetes and complementary approaches. So, basically, diabetes is not a localized disease, but a systemic disorder. By the time a person's diagnosed with diabetes, they usually have complications already. That's why when a person's pre diabetic, you actually need to correct that as soon as you can. And most people don't know that actually diabetes is multifactorial in etiology, and I'll discuss that in a bit.
Okay.
And it's important to treat the causes or downstream symptoms. And according to an Accord study done in the US, um, in which 10,000 diabetics were noted to have intensive glucose control, that means their blood sugar was really well controlled. It was still noted that this group still had more deaths and heart attacks.
Ah, okay.
Yeah, so as far as etiology and mechanisms involved in diabetes, they're the following. So
Doc,
as far as
what,
yeah,
what's etiology?
there could be underlying causes.
Underlying causes. Okay,
Yeah.
go.
So they could include allergens, microbial imbalance, toxicity, stress, nutrient poor diet, and nutrient deficiencies. So it's important to really find out what the underlying causes are to be able to control your blood sugar better and prevent possible complications. And aside from that, the underlying mechanisms in diabetes include chronic inflammation, oxidative stress, mitochondrial dysfunction, there's hormonal dysfunction, membrane and cellular dysfunction, impaired signaling and gene transcription, and enzymatic dysfunction. So people think that it's only important to control your blood sugar, but it's actually more than that. There's a lot of things going on in a diabetic individual's makeup. So we need to we need to address all those issues to be able to get good results.
So
Basically.
does this mean, Doc, that it could be caused by any of these or kailangan sabay-sabay yun lahat?
Yeah, any of these could cause it.
Okay.
Yeah.
All right. Thank you.
You're welcome. So these are the following myths associated with diabetes. So most people think that it's genetic. However, there's this field of medicine called epigenetics, in which the environment actually triggers the expression of these genes. So it may run in your family, but you don't have to suffer from the illness. So, but when your, let's say, your lifestyle or diet is similar to the one who has the problem, then there's a tendency for you to express that gene. So it's not a death sentence. If you have like the diabetes genes, it doesn't mean that you're going to develop diabetes too.
Okay.
Yeah, so it's really important to really take care of your diet and lifestyle in order for you not to develop diabetes eventually. And the second myth is that diabetes is not reversible. Well, in medical school, that's what we're mostly told, that if you're diabetic, you have to be on medications indefinitely, like the rest of your life. Yeah, but in clinical practice, we see that diabetes could actually be reversed. And not only in the field of holistic or integrative medicine, but also in conventional medical circles. So sometimes just a change in diet could actually reverse diabetes. Sometimes just a change in lifestyle, like for instance, exercising more and reducing stress could actually improve your blood sugar. Then another myth is that pre-diabetes is a problem only if it progresses to diabetes. Actually, when you're pre-diabetic, there's a lot of underlying issues going on already. So you don't want it to progress to diabetes. It's better to nip it in the bud. Better take care of it early. So the earlier you get diagnosed, you could actually do certain things to prevent it from getting worse.
Okay.
Okay. And then next is lowering blood sugar prevents cardiac events and reduces mortality. Yeah, so in the study I mentioned earlier, having well-controlled blood sugar doesn't mean that you won't develop MIs or heart disease. So you have to also address the underlying issues in a diabetic individual. And then finally, weight loss is necessary for reversing diabetes. Actually, it's not weight loss, but fat loss is what's important. Because when you say weight loss, you could actually be losing muscle as well. And you
Okay.
actually need the muscle so that you could burn more fat. So it's important that you reduce fat, not your weight.
So,
And actually, yeah,
so in your practice, talagang you've seen you can reverse diabetes.
yes, you can. And let's say people who are insulin dependent, sometimes we're able to reduce the dose of their insulin. And for those who are on medications, especially if they go on a whole food diet and take supplements that I would recommend, usually we're able to get them off of their oral hypoglycemic agents.
Wow. Okay, that's good.
Yeah.
All right.
Okay. So, what is sugar? So basically, sugar It's something that is inflammatory, so it could cause inflammation in the body. It actually suppresses your immune system, it suppresses your hormones, and is also acidic in nature. So, especially with the white sugar, one of my mentors told me that it's actually poison and it's more addictive than, let's say, heroin. The only difference is that one is legal and the other is not. So people have more access to sugar, and when they do get what do you call this? When they do get addicted to it, they eventually get all the complications associated with diabetes, including neuropathies, retinopathies, or nephropathies.
Okay. So
Yeah.
anong good sugar? Is there such a thing as good sugar?
Yeah, there are alternatives to white sugar. I may recommend something called stevia. Xylitol is also good. Sometimes brown sugar or cocoa sugar, and unfiltered honey. So these are the things that people could use as an alternative to white sugar.
Okay.
And it's important to know, like, for instance, if you have a slice of cake, you're
Mhm.
actually getting 8 tablespoons of sugar per slice. People
Ah,
don't realize that, but that's how much sugar you get in a slice of cake.
dito, bawal na mag-cake, ah.
Depende, gaano ba kalaki yung cake na yun, Doc?
Just a slice could actually suppress your immune system for 5 to 6 hours.
Wow.
Wow. Okay.
So, yeah, it's important to really watch your sugar intake. And it's also important to read food labels,
Okay.
especially if you see something called HFCS or high fructose corn sugar. It's actually even more harmful. It promotes obesity more than sugar. It increases appetite through a central action. Is more addictive than cocaine. Of course, it causes diabetes and chronic inflammation. The thing about this sugar is that it cannot be used by the muscles for energy production, and it could cause something called um, um, non-alcoholic fatty liver disease.
So, Doc, nakikita mo yan sa label. It's required to be...
Yeah, usually it says that high fructose corn syrup. So it's found in a lot of like over-the-counter products, mga preserved products, and even mga fruit juices. Sometimes they use this to sweeten the juice.
Okay. Wow.
Yeah. That's
And
really
Doc,
important.
so it's a non-alcoholic fatty liver disease, meaning high fructose corn syrup can actually cause that.
Yes.
A non-alcoholic fatty liver disease. All right, got that.
Yeah,
As opposed to a fatty liver disease caused by alcohol, right?
exactly.
Mhm.
Yeah.
Wow.
Okay. So
Okay.
the best test for your blood sugar is hemoglobin A1C because it tells us how your blood sugar is for the last 3 months. So this is better than your fasting blood sugar. Although the fasting blood sugar can give us an idea how your blood sugar is on a daily basis. Another way to check for your blood sugar is through serum insulin. So if it's elevated, it would tell me that you have possibly insulin resistance. And there are a lot of things that people could do to improve their blood or their insulin sensitivity.
Okay.
So ideally, it should be less than 5% for this hemoglobin A1C. Okay.
Okay.
So how do you reverse diabetes?
Paano ba? How
Yeah,
do you do it? Yes.
decrease the consumption of high glycemic index foods. So
Okay.
each food has a certain has its glycemic index. So the higher the glycemic index, the more harmful it is for the body. So the typical cutoff is 60. So anything above 60 is high glycemic, and anything below 60 is low glycemic. So you want to stick to the low glycemic fruits, for instance.
So,
And
what are the examples, Doc?
yeah, for instance, high glycemic are like, let's say, mangoes, grapes. They have high sugar content, so it's easily absorbed into the body. And of
Uh, uh,
course, refined carbohydrates could do that. When you
Meaning
eat a lot of refined
white rice,
carbohydrates,
no? White
but
rice. White
Yeah,
rice.
white rice. Yeah, white rice, white bread, white flour products have high glycemic indices.
Wow. Okay.
Okay, so other things that you could do are avoid hydrogenated oils, because in diabetics you see a lot of hardening of the arteries. So to prevent that from worsening, you avoid hydrogenated oils or trans fats. These are
Like example.
these are primarily vegetable oils.
Okay.
So it's better to use, let's say, extra virgin olive oil or virgin coconut oil for cooking.
For cooking.
Yeah, if you gotta use high temperatures, like in for stir fries, you want to stick to coconut oils. But for low to medium heat, you could actually use your olive oil.
Yes.
Yeah,
Correct.
yeah. So ideally, diabetics should also be taking omega-3 fatty acids to thin their blood, minerals or sugar blockers, certain hormones, natural anti-inflammatory agents, natural anti-glycation agents, and antioxidants. So I'll discuss that in a bit.
Okay.
Yeah. So treatment, you want to inhibit amylase, improve insulin sensitivity, reduce insulin resistance, inhibit G6P, glucose 6 phosphatase, increase leptin levels, reduce leptin resistance, and this could be done naturally so through sorghum bran, mulberry leaf extract, and fluorizidin polyphenol. Now we could go into details as far as
Mhm.
the minerals are concerned. So
Yes.
one of the things that I commonly prescribe for diabetics, in addition to maybe certain medications, I may recommend chromium picolinate or chromium polynicotinate. This is how it acts. It improves carbohydrate metabolism, improves insulin sensitivity, reduces blood sugar, increases insulin receptors, reduces appetite, and is a natural antioxidant. And the dosage is 500 to 1,000 micrograms per day. Some people use it for weight management, actually, this chromium.
So, are there natural sources or you just capsules use
Yeah, it's available in supplement form.
chromium? Okay.
Yeah, chromium. Yeah, actually, chromium is one of the minerals that's found in whole grains. But when you refine your grains, you're removing some of these minerals as well as B vitamins. So that's why it's better to have whole grain than refined grains.
Okay. Good.
Okay, so next is your zinc. Again, zinc, we discussed this before. It's really good for your immune system, but it's also as a good antioxidant. It improves carbohydrate metabolism, improves insulin sensitivity and pancreatic function, useful in diabetic ulcers because it helps with healing, and actually useful for both types 1 and type 2 diabetes. Magnesium, also involved in more than 300 enzymatic reactions. Like zinc and chromium, they all improve insulin sensitivity,
Hmm.
improves glucose metabolism, reduces hemoglobin A1C, and reduces diabetic complications such as congestive heart failure, hypertension, arrhythmias, and ischemic heart disease.
And what are the natural sources ng magnesium?
Usually green leafy vegetables.
Okay.
Yeah, but again, we discussed before that because of farming practices, we're probably not getting enough minerals from our regular produce anymore.
So that's why you need like supplements. No?
Yes, exactly.
Okay.
Okay,
Next.
so omega-3 fatty acids, they're anti-inflammatory. They're what we call blood thinners. So it
Mhm.
could be used as an alternative to aspirin, and it
Hmm.
has less side effects compared to aspirin. It's actually an essential component of your cell membrane. It improves insulin sensitivity and it's cardioprotective. Other minerals that we use include vanadium and manganese. I won't go into details on those two, but other vitamins include niacin.
Mhm.
So this is a B vitamin. So it acts by protecting your pancreatic B cells from autoimmune destruction. It is involved in DNA repair. It acts an antioxidant. It's a component of your glucose tolerance factor, similar to chromium,
Mhm.
and it may slow down the development of nephropathy. That's a
What again
kidney.
is nephropathy, doc? What is that again? Nephropathy.
It has to do with your kidneys.
Mhm.
Yeah, so people who are diabetics eventually may have kidney issues because of this issue. So
Okay.
niacin actually increases your serum adiponectin. So that makes your blood sugar improve.
Okay.
Vitamin E is also helpful. So insulin resistance and type 2 diabetes have been treated with PPAR gamma again agonists like thiazolidinedione. So these are medications that actually improve your adiponectin level. This adiponectin is an endogenous adipokine that has been shown to increase insulin sensitivity. So natural thiazolidinediones are vitamins E in the form of alpha and gamma tocopherol, and also some extract of chlorella.
Okay.
So that's that natural PPAR. Then go vitamin C. So vitamin C deficiency aggravates tumor necrosis factor alpha-induced insulin resistance. So vitamin C is not only important for your immune system health, but it's also
Mhm.
important for your uh, blood sugar.
Your blood sugar. Okay.
Okay, so chronic low-grade inflammation plays a major role in the development of insulin resistance. So the potential role of vitamin C, which is an antioxidant and anti-inflammatory agent, has been investigated in tumor necrosis factor alpha-induced insulin resistance. So, any questions so far?
So, doc, to treat diabetes, what you're saying is you need to get all these minerals and vitamins levels to reverse it.
Ideally, but if you can't do that, well, ideally you need to get tested to find out if you have any micronutrient deficiencies,
Let's see.
so
Oh,
that the treatment would be more specific. Because if
okay.
you have to take a lot of all these things, it could all add up. It could be expensive if you do all these things.
Okay.
So probably best to do this micronutrient testing.
Okay.
Yeah. But there are things that you could add, like for instance, among the minerals, use chromium. Among the vitamins, probably would use vitamin D or
Mhm.
C. Because here, as it's shown, vitamin D also improves insulin sensitivity. It also reduces blood sugar and fat mass, improves the immune system.
Mhm.
Yeah, so a lot of benefits from the use of vitamin D. And it's a quite common nutritional deficiency. I would venture to say that probably more than half of the population's vitamin D deficient, even here in the tropics.
Wow. Okay.
Yeah. Then there's the amino acid taurine. So
Mhm.
it's good for prevention and treatment of obesity. It reduces blood sugar. It may prevent and reverse the complications of diabetes. And it also improves smell, vision, and hearing. CoQ10, one of the underlying causes of or mechanisms in diabetes is mitochondrial dysfunction. So CoQ10 supplementation would actually help improve mitochondrial dysfunction. It could also improve endothelial dysfunction in statin-treated type 2 diabetics.
Okay. What's
These are
NP?
not so common nutrients, but so we'll just skip those. Uh, Alpha lipoic acid. This is something that we use quite commonly,
Mhm.
especially for those who have diabetic complications like neuropathies. It's an antioxidant and it's really good for diabetic complications such as neuropathies, ulcers, glaucoma, and nephropathies.
Okay. I,
This is the most commonly used medication for diabetes.
mhm.
So it's been around for a long time, and it's relatively safe
Oo.
compared to the
So
new
this is okay.
medication.
Metformin is okay.
Yeah, and actually, this is one of the first medications that was approved for uh, anti-aging, and this
Mm,
was just recently, maybe like 4 or 5 years ago. But anyways, with metformin, they noted a 39% reduction in MI or heart attacks, 36% reduction in death from any cause, 62% reduction in pancreatic and colon cancers, and there was no increase in lactic acidosis. So it's relatively safe. And this is how it works. These are the mechanisms of action of metformin. It basically decreases gluconeogenesis, which is the formation of glucose from, from glycogen or from protein sources. It also improves insulin sensitivity, decreases serum insulin levels, decreases triglycerides and hemoglobin A1C, and activates AMPK.
mhm.
So, yun, metformin is one of the most effective synthetic agents
That's
being.
over the counter ba?
No, it's still by prescription.
By prescription.
By
Okay.
prescription, yeah. And then we also have the thiazolidine diones, which has an insulin sensitizing effect, mediated partly by upregulating plasma adiponectin levels, thereby improving insulin sensitivity.
Okay.
So overall, what do you do to reduce complications? So you have to take antioxidants because in diabetics, there's a lot of oxidative stress going on.
Mhm.
So it's not enough to take your medications to control the blood sugar. It's important to take antioxidants as well. And they include glutathione, vitamins A, C, D, and E, CoQ10 and alpha lipoic acid, bioflavonoids, and carotenoids.
So these are the essentials.
Yes.
Okay.
Um, and then this natural anti-glycation agents, because one thing that sugar does is that it attaches to protein molecules. Like for instance, if you have excess sugar, it may attach to the protein in the lens of the eye, causing cataracts. It may also interfere with the protein in your skin, the collagen, causing wrinkles. So if you don't want to age quick, uh, you want to avoid sugar.
Sugar. Ah,
Yeah.
okay.
So these natural anti-glycation agents includes um, thiamine, that's a B vitamin, methylcobalamin or B12, carnosine, and alpha lipoic acid. And then finally, you want to take natural anti-inflammatory agents such as curcumin, ginger, quercetin, bromelain, and boswellia. Just be careful with taking some of the natural, like the omega-3 fatty acids, if a person is on, let's say, a blood thinner, because they actually would, uh, they have
Lead up.
synergistic properties. They would thin the blood further. So, yeah, so that's it as far as diabetes is concerned.
Okay.
So, Doc, I have a question. No? I was cut while you were doing your presentation, but I noticed in your slides that you have metformin listed as one of the. Is metformin considered a prescription drug?
Yes, it is. Yeah, you cannot get it without a prescription.
Okay, is it safe to be on metformin for a long time? For example, if you're like pre-diabetic.
I think so, as long as you're followed regularly by your doctor. And it's important to take other things besides the metformin, because it's not only important to control your blood sugar, it's also important to address the underlying issues like the chronic inflammatory process, oxidative stress, and the glycation that's occurring in diabetic individuals. And with oral hypoglycemic agents, or even the use of insulin, it's important to not skip meals, because if you skip meals, those medications would still lower your blood sugar. And if your blood sugar is too low, it could actually cause damage to your brain.
Mm.
So okay, I don't know if Anton asked this question already, but because of the harmful long-term effects of prescription drugs, is there a natural way in preventing or fighting diabetes without medication?
Yeah, there are those things that I mentioned, the minerals like chromium, but I wasn't able to create a slide for natural herbs that could actually help with diabetes as well. And they include Gymnema sylvestre, bitter
What's that?
melon. It's an Ayurvedic herb that's being used to
Mm.
control your diabetes. There's cinnamon, and then in the Philippines, one thing that's popular is your bitter melon or bitter gourd, otherwise known as ampalaya.
Doc,
Oh,
how about that herb called Sinta? Have you heard of that?
No, not yet. Sinta?
Yeah, I saw it in one of the ads. I'm not sure if it was an herb or a natural food supplement. So anyway,
Oh,
yeah. So Doc, what are the early signs of onset diabetes? For example, how are you able to monitor yourself if you actually have diabetes or you're going towards that? Is there a way of knowing that by yourself just by looking at what's happening to you? Because some people don't really want to get checked, diba?
mm.
yeah, sometimes, well, there's the three P's associated with diabetes. It's polyphagia, polydipsia, and polyuria. Polyphagia is when you're like always hungry. Polydipsia is when you're always thirsty. And polyuria is when you're urinating a lot. It has to do with the uh, too much sugar in your system. But to be diagnosed properly, it's probably best to have your blood tested, because
So
those
is
are quite non-specific. Sometimes sudden weight loss could also be a symptom of diabetes. So best to have your blood sugar taken, as well as some things I mentioned earlier, like insulin levels, fasting insulin, as well as your hemoglobin A1C.
yeah. So Doc, you said fasting blood sugar,
Hmm.
and you comparing it to HbA1c. That's the hemoglobin A1c, right?
Yeah.
So which one is more accurate in terms of knowing the level of sugar you have in your body?
The hemoglobin A1C, but it requires a visit to a laboratory. I don't know if they have um, gadgets that checks for hemoglobin A1C yet.
Actually,
I
I think our sponsor for the day, Fora, they also
Mhm.
have machines for HbA1c. So they do a home service for that.
Okay.
Yeah, so I think for the next shows we can plug that in how that usually works.
Hmm.
I know that they have that for a fact. Yeah,
Oh.
and
So maybe Dito, you can share the for blood glucose meter. What does it check actually?
okay, so it checks for the glucose glucometer. So I was asking the people from TSMC and for what are the benefits. No, the most important feature of the Fora Pro GD4A is actually the hematocrit range. Doc, it has a wide range, which means that it can be used by a wide range of users or different patient types that have
Hmm.
different hematocrit levels, which affects glucose measurements in glucometers. So I think that's the one that's special about it. And then with the GD40's wide hematocrit range, you're sure that measurement is accurate regardless of patient type. So I don't know, Doc, if they were explaining to me that the hematocrit ranges can affect the accuracy of the glucometer, especially if you're of different patient types. So, for example, if you're smoking or you're in a high altitude, you're pregnant, can affect all those levels. So with the Fora GD40A, actually it has that it already protects you from that. So the reading's always accurate.
Hmm.
Yeah. So Anton, we have a way of entering
Yeah.
the
So
yes. So how do
yeah,
we do this?
I guess for those people watching the Tuesdays week, Dr. Joel Lopez, we're actually giving away the Fora glucose meter and
Blood glucose on the system. Yes, correct.
uh, Fora Care. Sorry.
Yes. Uh-uh.
And we want to give this to people that really needs it. Yeah, and maybe uh, uh, so what we wanted to do is, can you email us? Our email is antondiaz@gmail.com on what's your story. If you have a glucose problem, if you have a pre-diabetic problem, or why do you need, or if you probably needs have a friend or a family friend who needs it, maybe send us an email, and in the next Tuesday with Dr. JLo, we will announce the winners of the for Pro
The
GD
Fora Comfort Pro GD4A
for
glucose
glucose meter.
monitoring system. Yeah.
On-
So it's
on-
very special, Anton. So thank you, TSMC and Fora Care for the partnership.
Thank you.
We'll put it in the description below also, and for those watching this live stream. So, Doc, siguro last few questions lang on diabetes. So if you avoid sugar, you won't get diabetes. Is that um, an
Um,
accurate statement?
Not necessarily, because sometimes inactivity
Hmm.
that could also lead to insulin resistance. So your body's not able to metabolize the sugar.
Okay.
Yeah, and we have essential fatty acids, and just as a title, we have essential fatty acids and essential amino acids, but you never hear of essential carbohydrates. So carbohydrates not really that essential.
Okay. So we have a question. When is the deadline to submit the story? Please submit it within by until Friday. As you watch this during the replay, we will be announcing it. In the next Tuesday with Dr. Jodo. So, do you have any more question dito? Do you have diabetes problems ba before? Parang alam na
Oh,
alam ko eh.
no, mine was the I just had the elevated, but everything's not back to normal. I believe with what Dr. Lo said that it's reversible. It can be reversible,
That's
and
good. Yeah.
yeah. So I'm happy that we're able to share this today because some people are still under the guise that it's not that it's irreversible.
Mhm.
So Doc, just to recap on what you said, no, kasi yung mga lifestyle adjustments are very important for diabetes. That's what I parang my takeaway from what you were discussing. So
Mhm.
aside from habitual exercise and considering natural food supplements,
Mhm.
of course knowing I think the glycemic index when you said that um, honey and brown sugar and those unprocessed sugars like stevia. Yeah. So Marty had a question about can honey be a substitute for sugar? I guess when honey, Doc, no, is if the source is not those natural or raw
Yeah,
honeys,
it should be raw, unfiltered honey, ideally.
raw unfiltered honey. And then I think your knowledge of the glycemic index is very important, no, Doc?
Hmm. Yeah, yeah.
So, meaning your sugars or your sweetness should come from really low glycemic sources.
Hmm.
So, just to recap that, you said that we have stevia, xylitol. What else did you say? Raw unfiltered honey. What else is good, though?
Cocoa
Um,
butter, no?
Cocoa sugar, I think, is
Cocoa
helpful.
sugar.
Yeah.
Cocoa sugar. Cocoa sugar. And then as far as natural food supplements in terms of Um, you said chromium picolinate,
Chromium
and
picolinate, zinc is helpful as well. Then certain herbs like Gymnema sylvestre, ampalaya or bitter gourd, and then we have cinnamon. Those are things that it's good for. That's are good for your blood sugar.
All
okay.
right.
So, Doc, when the vegetables are bitter, does that mean that it's actually good for diabetes? So,
Yeah,
like
in
for
general,
example,
bitter herbs are good for diabetics. And
so
failed to mention about the most recent, I guess, or most advanced treatment for diabetes is cell therapy. It's now being used primarily in Japan. They harvest the pancreatic islet cells from pigs, and it's given to diabetics, and they're able to actually reverse even type 1 diabetes, but it's just been around for a couple of years. So at least there are some more recent developments in this field.
Doc,
Okay.
as far as dieting or fasting or detoxes, will that help lower your or fight diabetes?
Yeah, definitely. Yeah, if you improve your body composition, then your blood sugar will definitely improve.
All
Okay.
right.
There's a few more questions before we close this. If you have questions, just put it in. First, we've answered this, but maybe Doc Jilo, can you inherit diabetes?
The tendency to, and I think I discussed about epigenetics earlier. It may
Mhm.
run in your family, but you don't have to uh, have it or express it if you have a good or healthy diet and lifestyle.
Okay.
Mm.
Next question. Coke Zero or Diet Cola?
Neither.
Bakit, Doc? Or yung mga zero sugar, ganyan.
Yeah, they're both acidic in nature, and I believe that they both use artificial sweeteners. Uh, the
Aspartame.
yeah,
So is aspartame bad for you, Doc?
they're what we call excitotoxins. They keep on exciting your nerve cells until it eventually dies. So it causes a lot of neurological issues when you take it on a regular basis, aside from acidifying your body.
Ang daming bawal kainin. There's a lot of things you cannot eat. Especially when you grow old, no? So, Doc Joel, where can they, can they consult you directly for diabetes issues?
Yeah, we actually do online consultations now because of the what's going on. And you could find out more about us through our website at jlopezmd.com, or you could check out my YouTube channel at Dr. J Lopez MD.
Okay, we have one more question. Um, is sugar-free products good for diabetic patients?
Well, you have to find out what's actually in those foods, because a lot of like sugar-free products, they use like synthetic sweeteners.
Mm,
So, Doc, another comment: Gatorade Pocari is a no-no for athletes.
Gatorade again has artificial coloring, and Pocari. Um, yeah, there's something in Pocari, but the minerals in it are okay. But I don't know about the use of other substances in it.
mhm.
Yeah, so if you want something better, just drink like water. You could actually, how do you call it? Um, Try carbonating your water. There's something called Soda Stream.
Mhm.
Yeah, if you really want something carbonated, you can use the Soda Stream, and you could actually use different natural flavors if you want that taste.
Okay.
It's an alternative to cola or a soda.
Okay. Question: are diabetics prone to COVID, and should diabetics take it seriously through monitoring using GT40 glucometers and HbA1c?
Yeah, usually those people who have comorbidities are the ones who are susceptible to COVID because their immune system is already shut. So, um, yeah, it's important to have their blood sugar controlled and be more proactive as far as improving their immune system, especially at this time.
Okay. And then, so when you monitor it every day, how would you do it if you have those
Yeah, if a
phones?
person has some what we call labile diabetes, in which they can't control their sugar really well, sometimes they have to check it up to 3 to 4 times a day. But if your blood sugar is relatively stable, then once a day should do if you're diabetic.
When do you take it? Before eating?
Usually fasting first thing in the morning.
Okay. Before breakfast, no?
Yes.
Uh, okay, that's good. Um, and I guess that's it. Dito, any last final thoughts or questions?
Actually, I'm good, Anton. I've my internet is really slow, so I've been kicked a couple of times. So na-miss ko yung huli yung pinag-usapan. But I just want everyone to again to stay tuned, and we're going to wait for your emails with regards to why you deserve to have a Fora Comfort Pro GD4A blood glucose monitoring system. So ayun, Anton. So you'll be the one to announce that in the succeeding Dr. JLo shows, right? Which we're having every Tuesday at 3:30 p.m.
Every Tuesday at 3:30 p.m. With Dr. J. Lopez, MD. Any final thoughts, Doc J Lo, before we close?
Thanks for having me again.
All
Thank you,
right.
guys. It's
Thank
nice
you.
seeing you again.
Seeing you.
Thank you
And
all.
if you have suggestions for the show, or if you want to have a disease that we want to discuss, Dr. J-Lo discuss specifically, or any topic that you want us to discuss, let us know also. Email me, antondiaz@gmail.com. Thank you so much. Thank you, Dito. Thank you, Dr. J-Lo.
Thank you. Thank
See
you.
you
Thank
next Tuesday.
See you next
Bye.
Tuesday. Bye bye.
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 Bye.